Hi, this is Chee-Wee here. So in this video, we will be looking at walking aids and some factors to consider when prescribing them for patients. Before we talk about walking aids, perhaps it would be good for you to pause here and ask yourself some questions to see what ideas do you have about walking aids. So the first question is, what do you think is the purpose of walking aids? Based on your own experiences, how many types of walking aids have you seen? And for these different types of walking aids, why would you choose to use one over another? Now that you have had a chance to clarify within yourself what state of knowledge you have about walking aids, let's go through some concepts that's commonly taught to students of rehabilitation. The first thing we'll be looking at is the purpose of walking aids. Beyond the most obvious purpose that a walking aid enables a person to be more mobile than they already are, there are several reasons why we would provide a person with a walking aid. Firstly, the walking aid will be able to relieve the body weight from the affected lower limb, and this will in turn reduce the pain experienced by the person due to perhaps an injury. With reduced pain, it will allow a more normal pattern of gait to take place, which prevents any further issues. With the walking aid taking on either fully or partially the weight of the body, it allows healing to occur without any adverse effects due to additional trauma to the injured area. If the person is experiencing mobility difficulties due to weakened muscles and/or poor balance, the walking aid will help with the support as well as the stabilization of the individual. Before you prescribe a walking aid safely, there are several factors that you must consider. So in the next slide, we'll be looking at some of these factors to ensure safety. These are some of the factors that you need to consider in order to ensure that a walking aid is safe to be prescribed for the person. Firstly, the person must have adequate strength in their upper limbs to be able to manipulate or move the walking aid. Secondly, there must be sufficient range in the key joints for either using the walking aid or performing the required mobility action. Thirdly, does the person have adequate pain relief for performing the task of using the walking aid and also to mobilize? If not, you should liaise with the appropriate healthcare professional to ensure that the person has adequate pain relief. Lastly, does the person have enough balance to use the walking aid? It is crucial that the person has enough balance, otherwise they may injure themselves whilst using the walking aid. After you have determined the factors and suitability of the person for a walking aid, the next step is to prepare them for using the aid itself. You'll first need to assess the task and the environment that the person will be in for an appropriate walking aid to be prescribed. This will vary from person to person, and it is important that you understand the needs and goals of the person. When you have chosen an appropriate walking aid for the context, the next step is to measure them for it. Walking aids can be adjusted for height and size, so ensure that you follow the correct method for measuring the height of the walking aid for the person. For example, an auxiliary crutch or elbow crutch or walking stick will be measured with the handle of the walking aid placed at the level of the person's wrist. This allows a slight flexion in the elbow, roughly about 15 degrees, when the person places their hand on the handle. If you are in a clinical rehabilitation setting, you may have additional equipment that may help you to progressively train the person in using the walking aid. For example, a parallel bar can be used to demonstrate to the person what partial or non-weight bearing is with the use of support. There is a wide variety of walking aids available on the market. If in doubt, either use the ones you're familiar with or do some research around the types of walking aids. or perhaps ask another colleague to recommend an appropriate walking aid for the situation that you have. Here on the screen are three types of walking frames. They have slightly different characteristics and also are used for slightly different purposes. These are also other types of walking aids with additional features. For example, the red rollator has brakes and a carrying basket built in. It also doubles as a portable seat when the brakes are on. The green rollator frame has got brakes and a carrying bag for carrying stuff, so it is also foldable for storage. In this screen, there are various types of crutches and walking sticks on display. You can see that there are various sizes, features, hand grips to accommodate different needs. There are even different colors to suit the person's style and preference. As mentioned before, we will need to teach the person on the correct and safe use of the walking aid. This includes how to stand up and also the type of walking or gait pattern to use depending on the amount of body weight that is allowed to be placed on the affected limb. If only a proportion of the body is passing through the affected lower limb, this is called partial weight bearing. If no weight is passing through the affected lower limb, this is called non-weight bearing. If the lower limb can take the full weight of the body, this is called full weight bearing. In terms of the type of walking pattern using walking aids, there are two main types. One is called swing to, and the other is called swing through. For the swing to gait pattern, the person only walks towards where the walking aid is placed in front. For the swing through gait pattern, the person places their lower limbs past the walking aids and in front of the walking aids. For a clearer picture of how these gait patterns look like, please kindly refer to the videos in your learning materials. When teaching the use of walking aids, it isn't just about walking in a straight line. There are various tasks and movements that people should be taught as well. On the screen are various movements that should also be taught to the patient. In addition, we should also consider the types of terrain and surfaces that a person may encounter and train them as appropriately. For example, will they be walking mostly within the home? If so, is the home with a hard surface or a carpeted one? What sort of outdoor surfaces will they also encounter? The walking aid is a piece of equipment that will last and be safe only if it's taken care of and repaired as appropriately. Therefore, the person or the carer should also be taught how to maintain and care for the walking aid. When prescribing a walking aid to a person, you'll always need to risk assess and take into consideration the safety issues associated with the individual and the condition, the type of walking aid you're thinking of providing for the person, the environment in which they will be using the walking aid, and also the things you'll be teaching the person to do in relation to the walking aid. When you're teaching to use the stairs with the walking aid, always be prepared and always have another person to help you. This is in case an accident happens and one of you can actually go get help. Always ask for permission and inform the person before you take the person to the stairs. Prepare a chair either at the top or the bottom of the stairs in case the person needs a rest. Do this preparation before you walk with them on the stairs. So, in this video, we have looked at the purpose of walking aids, the factors influencing which walking aid to prescribe, the type of walking aids available, the training you should be providing to the person using the walking aid, and some safety issues you should always consider before prescribing the walking aid. I hope you found this video helpful, and so thanks for watching.